Okay, I'm going to start the session. So, hello everyone, and thank you for taking the time to join us. I'll just go through some housekeeping. So, today's session is being recorded. The recording will be made available afterwards through IFS's Advice Solutions Hub, so ASH. Uh, so, depending on time, we'll either address questions during the session or towards the end. So, please feel free to submit them as we go. If you attend at least 80% of today's session, you'll receive eligible CPD points. So today's session, I'll be handing over to Jen, who's going to give us an update to the changes being made to aged care. So as we know, aged care, it can be one of the most emotional and financially complex decisions families face. So having the right advice can make a real difference to confidence, financial outcomes, and peace of mind. So on that, I am pleased to introduce our speaker for today, Jennifer Langton. Jen is an aged care specialist with over 12 years experience in aged care financial planning. She's previously presented with IFS and is passionate about helping advisors and families navigate aged care with clarity and compassion. So please join me in welcoming Jen. Thank you, Jen.
Thanks so much, Danica. And hello, everybody, and welcome. I think a lot of you probably have heard me present before, but for those of you I haven't met, as Danica said, I've been specialising in aged care advice for about 12 years or more. I've lost count um, from where I started, but it's been a long time. I've also done general financial planning and mortgage broking, so it's sort of broad industry knowledge, but then sort of specialised in aged care quite early from my career because I was going through it with my dad. I was juggling my elderly widowed dad in and out of aged care when I was first sort of coming through as an advisor. But I also have an older sister whose husband had early onset dementia and saw what they went through, which was, basically a financial train wreck for their family and how difficult the whole sort of transition was for them. So I think, it's really important to understand that you think about aged care and you think of elderly clients going into aged care, and you might think, oh, well, most of our clients aren't old enough to need aged care advice. It's not really relevant to our clients. But it's really important because this is something that really can impact people at a much younger age. And for a lot of people who juggle the care needs of elderly parents, they're still working. So they're in the years of, when they really should be sort of accumulating their wealth for retirement, and they're quite often having their sort of retirement situation compromised because they're having to pull back from their career because they're juggling either an older spouse or older family members. So I really want to broaden everybody's consideration for all things aged care. As Danica said, jump on if you've got a burning question that you want to ask. I'm happy for anyone to jump on and ask me a question. We don't have a huge audience today, so jump on, ask me questions when you're ready to ask them. Otherwise, I'm happy to stay on at the end and answer any questions you might have. So, changes ahead for aged care. I'll give you an overview of what's happening in the Australian aged care landscape, if I can get things to work. Here we go. The usual disclaimer, this is general information only. So what's happening this year? New Aged Care Act. I'm going to give you a bit of an understanding of why we had to have a New Aged Care Act, why there was a need for change, what will be changing and the impact that it's going to have on the Australian population, a bit of an overview of the aged care landscape, the changes to assessments, the changes to home care services, changes to residential aged care, and the transitional arrangements, which are really complicated. I'm not going to go drilling down deeply into the technicalities of this, but I really want to give you an overview so you can have an understanding of how complicated this is and how it's going to impact on consumers and the people you might be dealing with from an advice perspective. So the members, your super fund members, how this will impact them. And a couple of very high-level case studies just to sort of show you the differences. And the final one is a couple of your super fund members and what happened to them with an aged care situation. So let's crack on. The tsunami has arrived. So this is the baby boomer bubble. People have been talking about this for quite a long time. We've got this big cohort of baby boomers, this huge sort of bell curve of baby boomers that are coming through. And baby boomers range from about 70 through to about 85, maybe late 60s through to age 85. And we are really at the leading edge of the bell curve for the baby boomers aging out of the workforce and coming into the retiree and later retiree phase. I heard a quote the other day. I'm part of a high-level working group through a university up here in New South Wales that's all things aged care and seniors living. And one of the professors gave me a quote that she was saying that I think currently there are 12,000 Australians turning 85 this year, roundabout. In the next 5 years, there are going to be 60,000 Australians turning 85, and that number of around 60,000 will continue for about 10 years. So you can see we are really at the beginning of this large cohort of people coming into the aged care system and really into that age group where they're going to be having to be relying on a lot of government-funded services. So this is why there was the need for change. So the demographics of our population, but also the expectations of this population demographic. The baby boomers are the protest generation. So they're demanding higher standards of care, and they're not going to sit back and accept the poor standards of care that have previously been in the system. So they're demanding better standards of care. And there's more of them coming through, so something's got to give. We already have a shortage of aged care beds, so we have a shortage of residential care beds because there's been so much financial uncertainty in the industry. The vast majority of aged care providers have been losing money over the last 5 to 10 years. So there's been minimal investment into new aged care capacity, new aged care beds. So we are currently short. We have a shortage already, between about 250,000 beds short. And we need about 350,000 of them by 2030. So I'm already seeing aged care clients stuck in hospital, unable to find an aged care facility for 6 months. I've had one client that was stuck in a hospital bed for over 12 months. And that has a huge impact on our health system and a huge impact on government budgets. It costs approximately $2,500 to $3,000 to keep a person in a hospital bed per day. The government funds the cost of aged care, residential aged care, costs about $300 to $350 a day to keep somebody in an aged care bed. So the government don't want, it is too expensive for the taxpayer to keep people stuck in hospital beds. Costs a lot more for the taxpayer and the government to keep somebody in a hospital bed. Has a big impact on the health budget, having all of these people, these elderly people stuck in hospitals for months at a time. So we already have this shortage, and it's only going to get worse unless we can get more funding into the aged care system. Government expenditure, the intergenerational report that came out, I think last year it came out, the latest intergenerational report, and it showed that basically health and aged care are the highest line item of expenditure for the government over the next 20 years. So something had to change. So there has been a progress of reform with aged care. The main trigger, I mean, the government and successive governments have been aware of this, and they have been sort of looking into what needs to change. But most change was triggered by the Aged Care Royal Commission. That was about 4 years ago now. 4 to 5 years ago, the Aged Care Royal Commission kicked off, and it was largely driven by, media reports about very poor standards of care in residential aged care. Long story short, they put a lot of money into this Aged Care Royal Commission. The commissioners came back with, I think, 47 recommendations as a result of the Royal Commission. And all of these recommendations, a lot of them were framed around addressing the quality of care. But the bottom line, the underlying sort of driver for a lot of these issues, the underlying issues with poor quality of care, was lack of funding in the system. there was not enough money in the system for aged care providers to pay a decent wage for aged care workers, or to train aged care workers sufficiently, or to provide a decent level of food, or decent standard of care. So nobody wanted to work in aged care. So there were workforce issues, like a lot of these issues that were identified. The underlying driver was lack of funding in the system. So the commissioners came back with, I think it was 47 recommendations. The government went straight away in the 2021 budget. They put in a 5-year plan, and a lot of the instant sort of fixes were around addressing the quality issues in care. So they brought in a new regulatory model, new monitoring of aged care facilities, higher standards of training, higher wages in aged care, mandated working care minutes for each resident in aged care, mandated registered nurses 24 hours a day in aged care. So a lot of these issues that were addressed immediately were around addressing the quality of care. The 2 or 3 recommendations of the Royal Commissioners that weren't immediately addressed were the ones around fees and charges and funding. So straight away they addressed the quality of care, because when you think about it, you can't ask the general public to pay more for aged care when the standard is poor. So what the governments basically did was say, okay, we've put all of these measures in place to improve the standards of care, and now we're going to ask you to pay more for it. So there was an aged care funding task force that was stood up late 2023. They brought their recommendations through in 2024. And the recommendations were around increasing consumer contributions and increasing funding to aged care. So all of these things were thrown into the mix, and there was a new Aged Care Act that was legislated on the last sitting day of Parliament at the end of last year. So last November, I think it was 24th of November, there was a lot of legislation that passed through Parliament on that last sitting. And the new Aged Care Act tended to get a bit lost amongst all the other things that were legislated. But essentially, this new Aged Care Act comes into effect from the 1st of July this year, and it brings significant changes, particularly around funding for aged care. So the main impacts of change. So 1st of July, most of the changes come in. So we're about, 60 days out now from most of these changes. So the aim of the changes is to bring in a better standard of care for aged care recipients. And this is home care recipients and residential aged care recipients. It enshrines the human rights of the care recipient. So it's person-centred care. So the previous Aged Care Act, that was, I think, 1997, the previous Aged Care Act was framed primarily around aged care providers getting money from the government for caring for aged care recipients. So this new Aged Care Act is enshrined in human rights. So improved quality of care and higher standards and actual sort of legislative rights for the person in care. And it helps service providers by bringing more funding into the system, so it helps them to remain financially viable, but this increased funding in the system will encourage investment in the system to meet the growing demand. The government is still the primary funder of aged care. So currently, under the current legislation, the government pays about 76% of the cost of a person's residential aged care, and about 91 to 93% of the cost of home care services. Under the new legislation, the cost of residential aged care is 73% funded by the government, and 89% of the cost for home care is funded by the government. So you can see it's not a huge difference in the amount of money that the government pays for a person's care. The unfortunate thing is that the resident and the person receiving care, they don't see what the government funds. And I speaking to a very high-level government advisor recently, And she was telling me how terrible it was, the amount of money that her mother had to pay for aged care, and she gets nothing from the government. And I said, actually, you're wrong. The government's funding about $300 a day towards the cost of your mother's care. And she had no idea that her mother's care was actually being subsidised by the government, because from a consumer perspective, consumers don't see that. Anyway, we'll keep going. So the changes that are coming through. 2025, this year, is a very complicated year for all things aged care. So at the moment, we're under the current rules, under the current Aged Care Act. So anybody that's receiving care, so either home care or residential aged care, will be grandfathered, and they will stay under the current rules. From 1st of July onwards, there'll be new rules for aged care residents and home care recipients. So from 1 July onwards, everything changes, unless you are already in care. If you're receiving home care, then there's a no worse off principle. So the name of your fees and charges will change, and a few things will change, but you won't pay any more for the care that you're receiving than you're currently paying. And for people that are on the home care wait list, there are transitional arrangements. Even if they go into aged care at a later date, if they're on the wait list for home care services and they've been assessed, they will be a transitional resident. So I'll talk a little bit more about this, because this is where a lot of the complexity is coming in. So the new aged care landscape, some of these changes are already in effect. So to access the care system, and being a government subsidised system, there are hoops to be jumped through to access care services. So this is care in your own home or care in a nursing home, which is residential aged care. You have to jump through hoops, and there is a process to go through. And if you're talking to members, it's really important that they understand that there is a care system and that there is a process, and that's just nothing is instant. And I've had clients over the years that have come to me and they've said, well, we've been trying to put mum's name down at an aged care home, and they won't even put our name on the list. Or they're really not giving us any of their time. They're sort of fobbing us off. And the reason that I find most of them are being fobbed off is that they haven't been through the system, and they haven't got their approvals, and they don't have their approval code for care, which means that the aged care provider is not going to get the government money. And remember, the government pays more towards a person's care than the individual does. So you've got to go through this system. Another thing that came out just after COVID, there was a national seniors survey of about 4,500 Australians over the age of 65. And, various questions about the aged care system. And I can't remember what the question was, but the response to this question was people were shocked and horrified at how complicated the aged care system was. And when they came to interact with the care system, they were really confused and really confronted by the complexity, and they felt they should have been given prior warning as to how to access the system and how complicated the system was, because most of them had started accessing the system at a time of crisis, because mum or dad had had a fall and was in hospital, and suddenly the whole family's been brought in to try and work out what to do. And they were really shocked at how complicated the system was. So, in talking to members and in advising sort of super fund members, we don't want them to start thinking about aged care either for themselves or their parents when they've had a fall and they're in hospital. We want them to start thinking about this and being aware of this when they're actually going through their retirement planning journey. So to access the care system, step number 1 is a needs assessment. So you'll have a needs assessment, and you will be given approval and approval codes for the services that are appropriate to your care needs. So this is one thing that has already changed. Late last year, they brought in a new assessment system. So you still have to register. So anybody that wants to access any government subsidised care needs to register through myagedcare.gov.au. Once upon a time, I used to be able to tell people, just Google My Aged Care and the government website will come up. But if you Google My Aged Care now, there'll be about a dozen ads, and then you'll eventually get to the government myagedcare.gov. website. So the first thing to do is either call or register online for a health and needs assessment. Now, what has changed here is that there used to be 3 or 4 different needs assessments, or what there used to be ACAT assessments, ACAS assessments, CAS assessments, all these different types of assessments, which straight away was very confusing to the consumer. Now there is simply a single portal. You register with My Aged Care, which was always the case, but you will have a needs assessment. So there's only one type of assessment now. So they register with My Aged Care. It takes a couple of weeks before they will get their initial assessment. I have heard anecdotally that there are some places around Australia where people are waiting nearly 12 months for an initial needs assessment. So it's really important for people to understand that there is a process and nothing happens instantly. The only way you can get an instant assessment is if a person is in hospital. So if you've got somebody in hospital, you can ask the social workers and they will do your aged care needs assessment while you're in hospital. If a person's sitting at home and has, just sort of general care needs and they've registered for an assessment, they may wait up to 12 months just for the assessment. So important to know. And step 2 is financial assessment. So the financial assessment is changing quite significantly with the new aged care system. So the assessment required and the paperwork that you need to submit depends on the services that you're accessing. And under the new system, it will depend very much on your Centrelink or your Services Australia age pension status. So the new means testing for aged care is based on your Centrelink means testing, your income and assets record. And I can tell you from vast experience over all of these years providing aged care advice to, I don't know how many hundreds of people, is that probably 99% of the people that have come to me for aged care advice have an out-of-date income and asset record with Centrelink. And there were people in the first question, when somebody comes to me for advice or to one of our advisors for advice, the first thing we will ask them is your Centrelink record up to date? And they'll say, I don't know, because most of the time we're not dealing with the person going into care, we're dealing with the power of attorney, and they'll go, I don't know, Mum applied for the age pension 20 years ago. Or sometimes they'll even say, yes, we updated it a couple of years ago after Dad died or whatever, and I get them to get straight onto Centrelink and request an income and asset statement. 99% of the time, it's incorrect and it's out of date. So it's becoming even more important with the new system that people keep their record up to date and they request a statement every couple of years. You can do it through MyGov if you've got a MyGov account, and that they check that everything is correct. Because as soon as you go into aged care, the first thing that will be done is this means test assessment, and they will check your record, and your aged care assessment will be based on your existing record. And it is very hard to change anything after the fact. So if there's one thing, if you're dealing with members and they're coming to you for advice, is to really emphasise that their age pension or their Centrelink record is extremely important, and they need to keep it up to date over the years. And even if they do call through or go into an office or whatever, and update their records, that they also need to request a statement so they've got black and white proof that it's been done. Because I've had dozens and dozens and dozens of people over the years that have said we updated Centrelink, and 2 years later they still haven't updated our records. So tell people when you see them year after year, if they're interacting with the age pension system at all, make sure they keep their records up to date. So if you're a self-funded retiree or a blind pensioner, who blind pensioners are not means tested, Centrelink won't have more than likely won't have an accurate record of your financial situation. So if you're a self-funded retiree, a blind pensioner, or a Commonwealth Seniors Health Card holder, so they're a self-funded retiree that holds the Commonwealth Seniors Health Card, they will need to submit the financial assessment to Centrelink, and it's quite complex paperwork. And importantly, a lot of people, it's a big area of confusion, is that for age pension and aged care, the home is assessed completely differently. And it causes a lot of confusion out there in the general public. So if you're going into aged care, for example, if you're going into residential aged care, home is exempt if there's a spouse, indefinitely, while you've got a spouse living in your home. If there's nobody living in your home or no spouse in your home, your home remains fully exempt. It retains a principal residence exemption for 2 years. And then after 2 years, it loses the exemption. You'll become a non-homeowner, and you'll get, for most people, you'll get a letter from Centrelink to say your age pension is either reducing or you're losing your age pension because the home becomes an assessable asset. And I have a lot of clients coming to me for advice, or families coming to me for advice, because mum or dad have been in aged care for 2 years, and then, oops, all of a sudden they've got a letter from Centrelink to say mum or dad has lost their age pension, and they have an absolute panic. For aged care, the home is assessed completely differently. It is still non-assessable if there's a spouse living there. For aged care assessment, the home also has a protected person. There's the concept of the protected person. The protected person will be a carer who has lived there for 2 years or more, or a close family member that's lived there for 5 years or more, but they are only a protected person if they're receiving a Centrelink income or means tested payment. If they're not, then they're not a protected person. They can keep the home empty with somebody living there. It doesn't really matter, but if their home is accessible, it will have a capped asset value of $209,000, and that does not change. Index is up over time, but that it will retain that capped asset value for their aged care fees if it is accessible. So it causes a lot of confusion out there in the coalface. All right, the aged care system. So currently, this is the range of care options available. So, as I said before, you register through that My Aged Care portal. You will have that needs assessment, and you'll get approval for services. So, at the moment, you'll be approved for either Commonwealth Home Services Program, which is at CHSP, or under the new system, Support at Home packages, which is what is currently your home care packages, or you'll be assessed for residential aged care. The home care services of the Commonwealth Home Services Program, you can bring in wherever you are living. So if you're living in a retirement village, or if you're living in a granny flat, or if you're living in your private home, you can bring those Support at Home or Commonwealth Home Services care services in wherever you are living. And just to add a little bit of confusion to everything, there's a lot of private operators out there now, and there's a lot of private care options that people can opt to pay for. And sometimes they'll use a combination of private care services plus their government subsidised care programs. So it's quite confusing for a lot of people. In the next couple of years, the Commonwealth Home Services Program is going, and it's being folded into the Support at Home packages. So that eventually will be all that we will have: Support at Home packages and residential aged care, plus the private system. So the home care program, currently home care package program, that will be rebranded as the Support at Home program from the 1st of July. And the important thing with home care, or the Support at Home, is that there's more and more government funding being directed to home care. It's much cheaper for the government and the taxpayer to pay for a person's care in their own home. And it's also what most people want. So it's a win-win for the government and for the individual to be able to get the care services that you need in your own home. Under the new system, there's currently 4 levels of home care packages, 1 through 4. Under the new system, there will be 10 levels of home care, ranges from 1 to 10, and that includes a short-term restorative program. So if somebody, say, has had a fall and been in hospital for 6 weeks and they are able to go home, they might get a 3-month restorative care program, which will be, I'm not sure what level of home care, supported home that comes in under, but there's also a palliative care program. So what that does is gets rid of the support at home program and the palliative care program. They just come in under support at home and they'll be allocated a level. But the aim with home care services is to keep you living safely at home for as long as possible. And a lot of people think, oh, well, I'll just be able to get my home care services at home. More and more often now, I'm finding that there are clients where they'll be allocated their home care services, and when they get their letter from the home care, their home care package is available. So what happens is you have your initial assessment, and you'll get the letter to say, you've waited 6 months, for example, for your initial assessment. And then you have your assessment and you get a letter that says, yes, you're entitled to, say, a level 4 home care package. And you'll go, great. And it'll say, you now need to go on the waiting list for your home care funding to be directed to you. And at the moment, there's about 80,000 people on the wait list for their home care package. And there are people waiting 12 to 18 months to get their home care services. So first of all, big misunderstanding. The home care program is not the be-all and end-all to everybody, because what happens is somebody will have declining health. They'll jump through the hoops and be approved for their home care package program. They'll end up waiting 12 months before they get their home care funding through. And in that 12 months, their health declines even further and they end up going into residential aged care. So it's really important for people to understand that this is not a quick fix. As they get older, there is no value in being a stoic and, cracking hardy and saying, I don't need care, I can manage on my own, which is exactly what my father did. I really had to convince him to jump through these hoops and get into the system and get himself approved for home care, because there can be a substantial wait. And the other thing that people don't understand is home care services depend on where you are living. So I've got a mother-in-law that lives in rural New South Wales, about 40 minutes from the nearest home care base. So her home care package, most of the funding will go on transport because the home care providers charge from door to door. So there is no value. They get no value out of a home care package. She and a partner are both in their 80s. So it's a disaster waiting to happen, because their home care package, even though they're approved, they're getting they'll get virtually nothing, and they've been told that there's virtually nothing available because they live too far from anywhere and can't get their home care services. I've had other clients where because the home care provider will come out and assess your home as well as you. And I've had people who the home care providers have rejected them because the home had difficult access, a lot of stairs, rickety balcony, rickety stairs. I had one client where the father was a hoarder, and the home care providers will reject them. So there's a process to getting your home care package, but people really also need to be thinking about where they live as they get older, because where they live will have a very big impact on how they age well and how well they'll be able to integrate with the home care system as they get older. So when you're talking about retirement planning with members, it's really important to raise that issue of, yes, you might be 60 now, or you might be 65 now. We're doing your retirement planning for you. Have you thought about where you're living? Do you intend to live there for till the end of days, or are you thinking of downsizing at any stage? I mean, first of all, it's a planning opportunity, but it's also an opportunity to get people starting to think about their care needs as they get older, because where they live probably has the biggest impact, other than their health status, has the biggest impact on how well they will age. And I can tell you from experience that more people will go straight into residential aged care if they haven't made that choice to live in age-appropriate accommodation and make the move while they can. Because I also see a lot of people where they're 85 and going into aged care, and they'll say to me, oh, Mum talked about going into a retirement village for years, or talked about downsizing for years, but never actually got around to doing it. So supported home program, what users will pay going forward. So The support services will fall into 3 categories. There'll be a list of services, and there are price caps that have been released for the government on what home care providers can charge for the services. The amount that the consumer needs to contribute depends on what services they're using from what category, and their Centrelink means testing. So the 3 support services fall into clinical care, which is nursing, physio, wound management, therapeutic care. Then there's independent support, and independent support are things like bathing, transport, medication management, and then everyday living. And everyday living services are things like meal deliveries, gardening, home maintenance, cleaning, and they're the sort of things that you've been paying for yourself all your life. So for a full pensioner, they will pay nothing for clinical care. They will pay, automatically, they will pay 5% of the cost of their independent support, and they will pay 17.5% of their everyday living expenses. And the big thing, the big difference that really worries me with home care services is that at the moment, a full pensioner basically pays nothing for these services. There is meant to be a basic daily fee at the moment under the current system for home care providers, but most full pensioners have been saying, I don't want to pay that. And so the providers haven't been charging it. And what it does is reduce their home care package. And what it's done is led to all of these unspent government allocated funds in the system. So the government has turned around and said, okay, none of this is voluntary anymore. You must pay these contributions towards your care services. Part pensioners will be means tested, and they will pay between 5 and 50% of their independent support costs. They'll pay between 17.5% and 80% of everyday living. Self-funded will pay 50% automatically, 50% of their independent support and 80% of their everyday living costs. And you will see there under clinical care, nobody has to contribute anything towards that. So the government is paying 100% of the costs for your nursing and clinical care. But everybody has to pay towards their independent support and their everyday living services. And it will be advised to you as a percentage. So at the moment, the government tells you, and we can actually work out exactly what they will be required to pay under the current system. We can say you'll be paying $7,000 a year towards your care costs. Under the new system, we can't actually tell them what they will be paying in dollar terms. We can only tell them what percentage they will have to contribute. Then they have to work with their care provider to find out what care services they need and how much they will cost. And what will happen here, and I get this time and time again, is particularly with elderly people, if they don't know exactly how, they're very concerned about their cash flow, they're very concerned about money, they're worried about the cost of living. If they can't be told exactly how much these services will cost, they will tend to reject them and put up the barriers and say, no, we're not going to take those services. We don't know how much they'll cost. We don't know if we can afford them. And in the working groups that I'm with, there's a great concern out there that if people don't know what they're committing to, that they won't take their home care services. And the knock-on effect of that is that people will end up going into residential aged care because they didn't take the home care services and support that they needed to keep them at home. So the independent support and everyday living services will be means tested, and they will be subject to a lifetime cap. The lifetime cap for means tested fees under the current system is $82,000. So you can see there that lifetime cap is going straight up to $130,000 for new entrants to care. So residential aged care, this is nursing home care, and this is where the costs can be much more substantial. So some of these changes have already come into effect. From January this year, the room price, which is the RAD, prior to January this year, the maximum that an aged care provider could charge for their room was $550,000. They could charge up to $550,000. If they wanted to charge more, they had to go through an approval process, which was quite laborious and a lot of paperwork, to be approved to charge more than $550,000. So that came into effect in 2014. So a lot of aged care providers around the country just set their room costs at $550,000. Back in 2014, what we saw was that most providers put their rooms straight up to $550,000. But that cap hasn't been indexed and it stayed at $550,000. And if you think about it, real estate around the country has had quite a lot of growth over this last 11 years. So it was about time that they indexed that up. So in January 2025, that approval cap went up to $750,000. So we're already seeing a lot of aged care providers are banging their room costs up to $750,000. And of course, you will still see a lot of aged care providers that are a lot higher than that. I provide advice for people with rooms up to $3 million. But basically what they will do is they'll sort of set the room cost, they'll sort of anchor it to the cost of real estate in the local area. So in some rural and regional areas, you'll see rooms for $150,000, $250,000. In some of the more expensive areas of Sydney and Melbourne and the other capital cities, you'll see rooms up to $3 million. That $750,000 will also index up over time. So from July, the big change from 1 July is that there's going to be a 10% retention applied to what you pay for your room. And it's kind of back to the future. And it's interesting because prior to 2014, there used to be a bond retention amount. They used to keep about $3,000 a year of whatever you paid as a bond, which was the room cost. And to this day, I still get clients saying, oh, they take money from that money that you pay for the room. And under the current legislation, they don't. You get it all back. But under the new legislation, they're bringing in this 10% retention that's applied to what you pay for a RAD. So if you're paying a $750,000 RAD, you could be losing up to $75,000 of that RAD. It's applied at 2% per year over 5 years. Oops. Sorry, I've just lost my mouse. Here we go. The other thing that comes in from July is that on that room cost, so if you're going into a $750,000 room and mum doesn't have $750,000, she can only pay $500,000, for example, whatever you don't pay of that lump sum, you will pay interest on it. At the moment, that interest rate is fixed at the date of entry to care and doesn't change. So if mum's paying, if you're going into a room today and you're not paying the lump sum room cost, you're just paying it via interest payments. The current interest rate is 8.17%. It's set by the government. And it remains at 8.17% from the day you go into care until the day you either leave care or pass away. From July, it will start at the fixed mandated interest rate and it will index up twice a year in line with CPI. So it becomes a far more complex cash flow exercise to work out what your cash flow is going to be when your interest rate is going to index up twice a year. And in the background, you've also got the RAD retention amount being applied. So the algorithms for aged care going forward are far more complex than they are at the moment. And it's also going to be much harder for clients to actually work out what their cash flow and what their asset situation is going to look like. So hold on to your hat. This is the comparison of the old aged care fees and charges with the new aged care fees and charges. And don't get too hooked up on all of this and the terminology, but I just want you to see how more complicated it is for new clients going forward. So the current costs for existing aged care residents and anyone going into aged care up until the 1st of July this year look like this. You've got that room cost, and remember that could be up to $750,000 or more. You either pay it via lump sum or you pay it via interest or a combination. Everybody pays a basic daily fee for every single day in care. Nothing we can do about that. Then there's a means-tested fee, currently up to $428 a day. There's an annual cap of $82,000, and it also has an annual cap of about $33,000, and it also has that lifetime cap of $82,000. An additional service fee. So this is going without me clicking it. The ghost is in my machine. So currently you've got accommodation cost, then you've got a basic daily fee, means tested fee based on your financial situation, and this additional service fee set by the nursing home pays for little luxuries. Going forward, you still have your room cost, that's the accommodation cost. You still have your basic daily fee. You will also have a hotelling fee, which is means tested. You will have a non-clinical care contribution, which is means tested, not to be confused with a non-concessional contribution. And you will have a higher everyday living fee. So, which is once again set by the nursing home, pays for little luxuries. But I find that most aged care providers are charging these extra fees. So you look at that, they've gone from currently up to 4 different types of fees to 5 different types of fees with different means testing. Very confusing for most people. Okay, this bit here is even more confusing, just to make everything fun and for the consumer. So there are transitional arrangements, and these transitional arrangements, we are still waiting on the final detail from the government. Unfortunate timing is that the government's basically been in caretaker mode for the last, let's say, 6 months. So there's very little coming out of the government at the moment as far as legislation and guidelines. And we're still waiting for the underlying, they're still sort of arguing out and nobody's committing to anything at the moment on the underlying thresholds and the underlying rules for a lot of these transitional arrangements. But at the moment, in general terms, if anybody's currently receiving a home care package or has been approved for a home care package as of the 12th of September 24. So that was the day the legislation was first proposed. So as of September 2024, so anybody that went on to the approval list after that misses out on this. They had to have been on the wait list or receiving home care. They will be subject to transitional arrangements. So for support at home, there's a no worse off principle. So when the new system comes in, they will pay no more than they're currently paying. If somebody receiving support at home is a transitional person, if they go into residential aged care at any stage in the future, they will go in under the old aged care fee structure, but they'll go in under the new accommodation cost structure. So if you think about it, somebody might have been approved for support at home or a home care package at the age of, say, 67, 68, and I do get clients that old that are on have been approved for home care. They might go into residential aged care 10, 15, 20 years in the future, and they will go in as a transitional resident. So for aged care advisors like myself, the amount of work that we have to do and the amount of complexity in the system and the amount of complexity for clients that are going into aged care to work out what the hell they'll be paying for their aged care costs, the complexity is just, it's been multiplied a dozen times because there's just so much more complexity in the system. So a quick basic case study just to show you the difference, but pretty much an average person. So this is Ethel. She's going into aged care. She's paying $750,000 room cost. She's got a home worth about $2.5 million, lives in Sydney. For her aged care fees, it's capped at $206,000. For her age pension, no assessment for 2 years when she goes into aged care. She's got a few $1,000s in home contents, $420,000 in deemed investments, and she receives a part pension. So she's pretty average. Going into aged care. So currently, if she went into aged care today, she'd be paying it's actually $63.82 at the moment, that basic daily fee. I'll have to update that. And she'd be paying a means tested fee of about $15.41 per day. I'm ignoring the root cost. So at the moment, for her care fee, she'd be paying $78.98 per day. Under the new rules, she'll be paying a basic daily fee, still $63.82 a day, She'd be paying a hotelling supplement of $12.55 a day and a non-clinical care contribution of $18.69 per day. So you can see there, she's paying out about an extra $16 a day in care fees. And that, I can tell you, adds up to quite a lot of impact on your cash flow over time, over a year. And if you look at the room cost, you know, she obviously doesn't have enough money to pay that full $750,000 RAD. If she sells her home, she's going to end up with a lot of money left over, isn't she? So I can tell you straight away, she would, if she sold her home, she would lose all her age pension, and her means tested fee would be significantly higher. She'd be going up to, you know, probably 100 or over 100. She'd go up to the maximum means tested fee going forward. So she'd be her whole cash flow situation would change if she sells her home. And unfortunately, most people, the minute they start thinking about aged care for a loved one, a family member, they don't know where to turn. So they'll talk to the lady at work, or they'll talk to their Barry at the bowling club, or they'll talk to everybody that they know to say, how much is it going to cost for aged care? How do we pay for this? And everybody says, oh, you just have to sell the home. And more commonly than anything else, I get people coming to me and they've already got the home on the market. And, you know, sometimes, you know, if you've got the home on the market, it's too late, you know, to pull the home from the market, because quite often selling the home gives the worst outcome for people going into care. So there's real value in getting advice. We can save people hundreds of thousands of dollars, but we can also give them clarity, and so they understand the situation. We remove a lot of stress from families that don't know which way to turn. So this is not so much a case study, but this is an experience that I recently had with a client, two brothers who are members of one of your funds. It's a big one. And this came through to me as a referral through from Retirement Essentials, who we have a referral arrangement with. So mum went into care with a RAD to pay of $600,000. Two sons, one age 67 and one age 69. I spoke to the 69-year-old, both members of the same very large fund. Mum had about $250,000 in cash, full age pensioner. The house was in complete disrepair. Mum was a hoarder. Mental health issues, was a hoarder. The house was in disrepair. It's going to take them major work to even get it to the stage where they can sell it. No capacity. She has dementia, so she has no capacity to enter into any loan agreements. They asked around everywhere. They talked to the lady at work. They talked to the lady down the road. They talked to everyone. They talked to the lady at Centrelink. They told me the lady at Centrelink told them to withdraw $175,000 each from their own super fund to pay mum's RAD. So brothers aged 67 and 69 withdrew $175,000 each from their super fund, called through to their super fund. And he told me that when he called through, they called through to make their withdrawal. They said, we've got to take money out of our super fund to pay for mum's aged care. So that money that was given to mum to pay for her aged care is means tested for mum. Centrelink don't care where that money comes from. They simply will treat that extra $175,000 from each of those men as mum's asset. So her means tested fee increased due to the extra accessible capital. Mum has significant ongoing cash flow shortfalls that the brothers are having to fund. Both brothers are aged pensioners, and they're suffering financial difficulty, particularly the 67-year-old who has just recently been granted his age pension. And they've found out that that $175,000 each that they gifted to their mother is an accessible asset towards their age pension. That RAD balance, when mum does pass away eventually, will be paid back to the estate after mum passes and will be held up in probate. Mum doesn't have a will. So this situation and that money that they've gifted to mum could be a long time before they get access to that capital again. Because with aged care, there is no requirement. Aged care facilities are not a bank. So there's nothing in the legislation that allows them to say, we made a big mistake, can we get $175,000 back from that RAD that we paid for mum. Whoops, it was a mistake. We didn't mean that. So there, to me, if you're talking about the value of advice and the value for super funds being able to be alert and aware to the needs of not just elderly clients and elderly members, but these working and new retirees that will be impacted by the care needs of their older family members. So this is a recent study, just to sort of wind things up for you, an AMP client survey that was done late last year. And these are 65-year-olds, 65 plus, that were surveyed. And it was quite a big survey. I can't remember how many people they surveyed. But 80% of people, when asked about aged care, 80% of people felt that they were not prepared for it. They were worried about the costs. 70% of them were worried about the cost of their future aged care. 30% of them were worried about being a burden on their kids. 50% of them have got no idea what sort of government support is available with aged care. So aged care advice is important when they get to the pointy end and they have to go into aged care, and we need to crunch the numbers for them to work all of this out. But for your members and for the members of super funds, there is real value in giving advice and guidance and education to the members on a broad, broadly give this education and remove some of these unknowns for people that are going to interact with the care system in the years ahead. So the value of advice, and I think, to sum all of these different things up, and with aged care, it's very different from normal financial planning. It's very different from normal finances as people think about them. There's a lot of different factors that go into aged care advice. There's conflicts between families, there's complexity of the system, there's stress, there's guilt. And this is unknown because nobody's planned for aged care or learned anything about it. They don't know what to do. They don't know where to turn. There is real value in people but knowing where to turn to get support, because there are so many barriers to making the right decision. So getting education and advice can take away the feeling of being overwhelmed, and which is just such a barrier to making the right decision and removing a lot of stress for people. And I think, my friends, that is the last, conversation tip. So look, if you're talking to members, it's really important to open up the conversation, because these new rules just mean there is even more importance for people to understand what they're going into and understand how to navigate the system. So be on the front foot with people, regardless of what age. Don't think you should only be raising the conversation about aged care if people are walking in your door with a walking frame. People that are going through retirement, even pre-retirees, more often than not will be juggling the care needs of older family members and worrying about older family members. So they just need to know where to turn. Industry super funds, the super fund now is replaced the bank, the local bank, as the main financial institution in people's lives. People turn to their super fund. Super funds have been their trusted financial planner for all of their working lives. So, it's really important for funds to be able to provide the information and guidance that people need around these important financial decisions that are going to impact them around their retirement and in their retirement. And I promise you that's the last slide.
Thank you, Jen. Thank you so much. Very informative and practical session. If you haven't already, we've got a minute, so feel free to submit your questions. Adrian also says thank you for a great session, so appreciate you joining us. Question from me. So the changes appear to be complex, particularly with people not knowing what to exactly pay. It also appears to be more expensive. It all doesn't sound very positive.
Look, it doesn't, but remember, as I said before, the government still funds the vast majority of the cost of everyone's care. It's just that we don't see it.
Sure. Is there anything you would like to see within the industry that would, I guess, make for a positive change also?
In the aged care industry?
Yeah, absolutely. Yeah.
Look, I would really like... Anybody that's got children in childcare, you know how much the government contributes towards your childcare costs. I actually think the government should be getting out there and should be quite clear the amount that the government pays towards a person's care. I think that would destigmatise the costs quite a lot. But at the end of the day, you're never going to make people happy about having to pay for care. Everybody thinks that it should be free. The government, it's terrible. What the government take all of your money. I hear these things all the time. Or the nursing home take all of your money. I find it really important, and when I give my public webinars, I find it really important to try and destigmatise that and to try and remove some of those barriers to good decision making, because people that get overwhelmed by these costs tend to put up barriers and be very, very anti the care system. We're pretty lucky in this country. It's not perfect. We have a pretty good care system. I think we should acknowledge that and accept that, and look at the positive side of it, and not sort of focus on the negatives. And I try, when I'm talking to clients and when I'm doing my public webinars, I really try and bring people around to understanding that.
Sure. Wonderful. We have gone over time, but we do have one question if you've got some time still.
I do. Yep.
Yeah. So I've got a question. You said usually worse off to sell family home, but is this just in the short term as things change after 2 years, or should they rent out the principal place of residence?
It depends. That's a good lawyer's answer. It depends purely on the exact circumstance. So it depends what other assets they have, because remember, they've got a room cost to pay. If they've got a $750,000 room cost and nothing else to pay that room cost with, we've got to look at how we're going to fund that. So maybe selling that $2.5 million home is the best option. They can rent that home. The rent will be accessible for their aged care fees and their age pension. They can also borrow against the home. One of the viable strategies that, people that want to keep the home, it often works out better financially, and I can calculate all of this out, to put an equity release loan in place and not rent the family home out, because the rent impacts age pension, rent impacts aged care fees. Equity release loan, if we set it up correctly, for most people, won't impact their age pension.
Wonderful. And with these types of questions, they can submit questions to yourself, or is there a facility that our advisors can reach out to?
You know what? I'm always really happy to be a point of contact and to answer questions when they come through, because for two reasons, I'm helping out clients, but also I'm helping out my fellow advisor to sort of get a better understanding of the system and sort of mentor people through with this. The best email to put it through to is just to put it through to the support@personal advice email. And just to clarify that for people, personal advice, Aged Care Personal Advice is our consumer brand. Aged Care Steps is our training entity, and that's the brand that we provide training to the financial advice industry. Aged Care Personal Advice is our consumer advice brand. So if they put a question through to support@personal advice, we will always get back to them pretty much straight away, or within 24 hours, we'll get back to them with an answer. So if you're talking to a member and you think, I don't know whether this is advice or not, or more than happy for you to contact me or one of our team, and we'll be back to you.
Wonderful. Thank you. So I'm just going to wrap things up now. So thank you again, Jen, for sharing your expertise and joining us. So as a reminder, today's session is being recorded, so it will be made available through ASH. If you did attend at least 80%, you'll receive the CPD points. We hope that you all found today's session valuable, and it gives you greater confidence when supporting clients with aged care needs. So thank you again, and we look forward to seeing you in the future webinars. Take care and have a good day.
Just before you wind it up completely, yes. I just remembered I've got some resources, some advisor resources in ASH, and that's just reminded me I need to update them with the new regulations. So
yes.
Watch this space.
All right. Thank you, Jen.
The current stuff relates to the current situation. So I'll be getting some new stuff through for ASH in the next couple of weeks.
Beautiful. Thank you so much. All right.